Several types of therapy have been developed to treat a variety of disorders. In this unit, the different methods of therapy will be discussed. It will describe how the treatment of mental disorders changed over the years, including early inhumane treatment, the development of using drugs, and the community health centers. In addition, the biomedical and psychological treatment for psychological disorders will also be discussed. Three primary forms of psychotherapy, which are the behavior therapy, cognitive therapy, and humanistic therapy. This chapter will also describe the different modalities of treatment, which includes individual therapy, group therapy, couples therapy, and family therapy. The other method of treatment will also explain in this unit, such as combined approaches and technology-based treatment.
Way back in 14 to 17, people diagnosed with mental illness such as schizophrenia were often thought to be possessed by demons, hence inhuman practices such as exorcism and execution are done. People with mental illness are primarily confined in mental asylums wherein the primary function is warehousing, not treatment. The patients or inmates were often beaten and chained. Bedlam or Bethlehem Royal Hospital in London opened its gate to patients suffering from psychological disorder in 1547. The patients were chained, whipped, and allowed to lie in their waste until they died. In 16, trepanation was a method used to treat mental illness that involves creating holes in one's skull using various tools such as trepan, bore, grill, and even saw. In the late 17, the tranquilizing chair was developed by Dr. Benjamin Hush, the father of American psychiatry. The patients were strapped into this chair and remained until they seemed calm down. Dr. Hash also cures his patient with fright by putting them into coffins and convincing them that they're dead. But despite it, he encouraged his staff to treat the patients with kindness. In the 17s, some hospitals sold tickets to the general public for entertainment, especially to ladies and gentlemen of the British upper class to watch the asylum inmates' behavior. In the late 17th and early 18th, few doctors began to make reforms by removing patient chains, forbidding physical punishment, and using a more psychological approach to treat mental disorder. The reform movement began in the 18th century. It focused on moral therapy by providing patients with human treatment in a more conducive environment. It is a form of psychotherapy wherein a person with mental disorder could be helped by being treated with compassion, kindness, and dignity in a clean, comfortable environment that provided freedom of movement, opportunities for occupational and social activity, and reassuring thoughts. However, by late 18, moral therapy has been abandoned since it became more overcrowded and also the public lost interest in supporting it. So the funds became light and treatment became scarce. These are the people who spearheaded moral therapy. First, we have Philip Pinel, who was born in 1745 and died in 1826. He unchained one of his patients at La Salpêtrière rather than Amok as had been feared, and they profited in kindness and freedom. He named his approach to treatment as treatment moral. Next is William Tooke, was born in 1732 and died in 1822. He promoted human custody and cared for mental disorders in England. He also led the movements for reform. Elizabeth Karen Ziman, Nellie Bly, is a famous activist and American journalist who publicly campaigned for the improvement of the people diagnosed with psychological disorders through her investigative articles. She was born in 1864 and died in 1922. Lastly, we have Dorothea Dix, was born in 1802 and died in 1887. She is a Boston school teacher who publicized the terrible living conditions and lack of equitable treatment of patients. She was able to convince Pope Pius IX to examine the unjust ways of treatment of people diagnosed with psychological disorder. At the beginning of 1880, a Swiss physician named Gottlieb Burckhardt performed the first lobotomy in which he removed some parts of the brain cortex, and his 6 patients were suffering from auditory hallucinations and other symptoms of schizophrenia. In the 19th, Sigmund Freud developed psychoanalysis, which is the first psychotherapy that spread from Europe to the United States. In 1950, mental hospitals replaced asylums and antipsychotic drugs were discovered.
One of the psychological treatments used to treat psychological disorders is through medications. People who have addiction or substance abuse problems also have other mental health issues. There are 3 biomedical approaches used to treat psychological disorders, namely drug therapy, psychosurgery, and electroconvulsive therapy. First is drug therapy, which aims to treat psychological disorders through medication, and is usually combined with other kinds of psychotherapy. There are main categories of drugs used to treat psychological disorders: anti-anxiety drugs, antidepressants, and antipsychotics. Anti-anxiety drug medication is used to prevent and treat anxiety associated with various anxiety disorders. Next is antidepressants, which are used to treat necessary mental disorders such as depression, anxiety, obsessive-compulsive disorders, and many others. This substance is either natural or man-made. Lastly, antipsychotics are the type of psychiatric medication that are available on prescription to treat psychosis. There are specific atypical antipsychotics drugs that may lessen the signs of negative schizophrenia, and there are traditional and atypical antipsychotics that work on the symptoms. The next biomedical approach is psychosurgery, which was developed in the 1930s. It is a surgical procedure designed to change psychological or behavioral reactions. This field of psychology is defined by the World Health Organization as a selective surgical removal or destruction of nerve pathways for the purpose of influencing behavior. Simply, it is a brain surgery performed to treat psychotic disorders and is rarely used today, and more controversial than electroconvulsive therapy. Preferential lobotomy was once used to treat psychotic disorders. It is already considered an outdated and inhumane procedure.
Now, we just finished talking about drug therapy as a biological treatment. So let's move on to the second major area of biological treatment, and that is psychosurgery. Psychosurgeries involve medical procedures on the brain in an attempt to alleviate the symptoms of psychological disorders. Now, the first psychosurgery we're going to discuss was actually widely overused and had tragic consequences, including sometimes death. This is the prefrontal lobotomy. The lobotomy involved cutting the connection between the prefrontal cortex and the lower area of the brain. Now, this technique is no longer used today. But if you think back to the material on Lesson 3 in the brain and behavior, you'll see why this procedure dramatically changed the individual. We know that the prefrontal cortex is important in thinking, and it's imperative for working memory and planned action, and the lower area of the brain is more concerned with emotion. Therefore, some believe the surgery would have the effect of modifying behavior and perhaps disengaging the disruptive thought patterns associated with hallucinations and confused thinking. In reality, the procedure produced profound personality changes, often leaving the person listless or appearing absent. In addition, there was a likelihood of experiencing seizures. In many cases, people were left in a vegetative state. Now, the lobotomy was performed by taking a sharp instrument and placing it near the corner of the eye, hammering that in, and then moving the instrument back and forth, thereby modifying or destroying parts of the brain.
Lastly, we have electroconvulsive therapy, which was developed in the 1930s, wherein an electric shock is given to lightly anesthetized patients to produce a brief cortical seizure. It can provide rapid, significant improvements in severe symptoms of several mental disorders. ECT is used to treat the following: severe depression, especially when accompanied by detachment from reality; treatment-resistant depression, a severe depression that doesn't improve with medications or other treatments; severe mania is a state of intense euphoria, agitation, or hyperactivity which occurs as part of bipolar disorder. Catatonia is characterized by lack of movement and speech, fast or strange movements, and other symptoms, which is usually associated with schizophrenia and other mental disorders. But in some cases, it is caused by other medical illness and agitation, where it is often seen as the aggression of people with dementia that is hard to treat and affect their quality of life negatively.
Electroconvulsive therapy, or ECT, is often called a treatment of last resort for patients who haven't had success with drug therapies, who have life-threatening psychiatric conditions, or who are suffering a catatonic state. ECT induces a brief seizure in a patient which resets the brain functions associated with some psychiatric disorders.
It's typically indicated for treatment-resistant psychiatric conditions, most commonly mood disorders or depression, but there are multiple types of depression, so it can also be used to treat bipolar depression.
The majority of ECT treatments are managed like outpatient procedures, and the patient is given general anesthesia.
When the patient's asleep, the stimulus is delivered, the seizure is monitored, they'll have just one seizure.
An electrical current is given to the brain, low enough not to harm the patient, but high enough to trigger a seizure. The treatment team can even touch the patient.
The thing that concerns patients the most is that they know that they will be having a seizure. They're concerned about what may be happening while they're either asleep or while they're having that seizure. And thanks to the anesthetic, it's very hard to tell. In fact, only way you can truly tell if they're having a seizure or not is to kind of monitor the motor activity and then monitor the EEG activity.
The patient awakens soon after and is monitored for a short while like any patient who has undergone general anesthesia. Within a half hour, they'll be discharged. In some cases, a handful of ECT treatments may be all that's needed to make medication therapy work. For other patients, regular recurring ECT treatments may be needed. In Morgantown for the WVU Health Report, I'm Dr. Raleigh Sullivan.
Next method is the psychological treatment for psychological disorders. Psychotherapy is a treatment that involves psychological techniques, wherein a systematic interaction between a trained therapist and someone seeking to overcome psychological disorders and achieve self-development. This treatment is more like an education, wherein the therapist is the teacher who gives direction to the student, which is the patient. Furthermore, the progress of this treatment depends on the patient's determination and effort. There are several types of psychotherapy, and among them are psychodynamic, psychoanalysis, behavioral therapy, humanistic therapy, cognitive therapy, and cognitive behavioral therapy. These forms of psychotherapy are the most influential, and most of them can be used one-on-one or in groups.
Psychotherapy is a form of treatment for mental health disorders where a patient can allow to train their minds to cope better by talking. There's different types of psychotherapy, including exploratory, where you try to see by talking to someone what might have been one of the triggers and causes of the depression. Another way would be cognitive behavioral therapy, which is another modality where people can or patients are able to learn coping mechanisms to deal with some of the symptoms, including anxiety and depression. One of the questions that I get about psychotherapy is whether it's going to be effective in terms of how long it might take to be effective. And I think that one of the things that we see with psychotherapy is that it might take longer for you to feel, for the patient to feel relief from psychotherapy. But what they will see is that it lasts longer in terms of the effects of the psychotherapy, because you're able to learn things that you could use at other points of your life when there are other events that could trigger the similar symptoms.
The first form is psychodynamic therapy. It seeks to improve the individual's self-awareness and understand the effect of the past on the current symptoms. Moreover, psychodynamic therapy has gradually developed from the psychoanalytic tradition that focuses on individuals as they respond to unconscious processes and childhood experiences, and that seeks to enhance self-insight, where it helps the patient to know the unresolved conflicts that originate from the past relationship troubles. Lastly, it treats the symptoms of unconscious and repressed feelings, thoughts, and motives. The next type of psychological treatment is psychoanalysis. It is the first talk therapy that has been developed by Sigmund Freud. Psychoanalysis is more effective in treating less serious mental disorders than those patients in mental hospitals. Additionally, it helps the patient reclaim their unconscious thoughts and feelings so they can understand their actions. Hence, psychoanalysis gives an insight into the origins of the patient's psychological problem that focuses on changing behaviors and thoughts. This therapy was a dominant therapeutic technique in the United States in the early 20th century, but over the years, it has waned significantly in popularity and influence. However, it is still widespreading in some parts of Europe. Furthermore, Freud believed that most psychological problems are the outcomes of unconscious processes and the trauma that patients experience in their childhood. He believed that psychoanalysis would bring the patient to consciousness and would produce his feeling part, or called catharsis. Freud used various methods to bring unconscious material to consciousness. These methods are dream analysis, free association, and transference. In dream analysis, a therapist would give an interpretation of the meaning of dreams. On the other hand, in free association, the client relaxes and would say anything that occurs to their mind at the moment. However, the client would show resistance to recalling the situations or giving thoughts, since the ego would try to block the painful conflicts. While in transference, the client transfers all positive and negative emotions associated with client's other relationships to psychoanalysis.
All of us can feel overwhelmed and burdened from time to time, as if all the hurts and trauma from our past, the stresses of everyday life, and our goals and dreams for the future have gotten all tangled up, paralyzing our mind. This tangle disturbs our relationships, interferes with our personal growth, makes us feel out of control, and creates painful emotions like sadness, anxiety, anger, and fear. This is when seeing a psychoanalyst can have lasting and life-changing benefits. Psychoanalysis is a deeper, more personalized form of talk therapy, and studies show that the benefits last long after treatment ends. In psychoanalysis, patients can talk freely and safely share their feelings, dreams, memories, desires, and life stresses. Patterns emerge, past traumas, perhaps long forgotten, and worries about the future come into awareness. As the therapy deepens, you and your analyst will unravel this clustered ball of yarn, string by string, helping you find relief from emotional distress, improve personal relationships with friends, family, and loved ones, come to terms with the traumatic past. feel understood as a unique individual, and take more pleasure in life. Psychoanalysis unlocks the past, informs the present, expands the future. For more information about psychoanalysis or to find help near you, visit www.apsa.org.